It's all good. So he's here with us for a discussion, and we're talking about sickle cell anemia, like we mentioned earlier on. But good morning, Doc, and welcome.
Good morning, Raza.
How are you doing?
I'm well.
Great. It's amazing to see you this time around in my office and not your office.
Yes, definitely.
Once again, thank you for the birthday gift, though.
Oh, you're welcome.
Yeah,
You're always
I
welcome.
appreciate that. Anyway, so straight to our discussion this morning. But last week it was World Sickle Cell Day.
Yeah.
Unfortunately, for some reason, not much was heard about it. And it got us wondering what is happening. Why wasn't really given that much attention? But we looked into the statistics, and it's still scary, and it needs to be mentioned.
Yeah.
And that's why today we chose to really give it time and have a discussion on those one.
Yeah, that's great.
Yes. So first of all, let's look at it. Sickle cell. What is that?
Well, to start with, it's a form of anemia. There are several forms of anemia, and anemia basically is when the blood is not able to carry out its function optimally, especially the red blood cells. You know, either they are low in number or they have a defect, so they are not able to perform their functions, and it results in some symptoms like shortness of breath, difficulty, in performing daily tasks, etc. So it's just a form of it's one form of the anemia group, and it is inherited, right? We have iron deficiency where it's nutritional, but then sickle cell anemia is an inherited form of anemia. And let me just explain why we call it sickle cell anemia.
Before then, though, when you say it's inherited form, that means it can only be inherited. You don't get it. It's not a disease you try to get infected with.
No. You can only get it from either parent. So you can get a gene from your mother, another gene from your father, and then you get the sickle cell anemia. You know, our body is controlled by genes. The way your nose looks is a gene that made your nose look like that. The way a white man's nose looks is a gene that made it look like that. You know, some people will be bald, is a gene. Others will not be bald, is a gene. All right, so phenotypically, or how our outward appearance shows, it's controlled by code. They are genetic codes that are inside our body, and information that expresses on the outward. In the same way, the red blood cell, it's a round shape structure. All right, we call it biconcave. So let's take maybe the Lebanese bread.
Yes.
And then you have a little depression on either side. That's how the red blood cell is, and it can bend. It can meander its way. You can shape it in different ways. So you can pass through every corner. That's how the red blood cell looks like. And the gene that makes it look like that, we call it hemoglobin A gene. All right? hemoglobin A gene. Now, for some reason, there could be what we call mutation. The mutation is a change in the information. For instance, your nose is supposed to be round. Now the information has been changed, and now your nose is looking maybe pointed. So a change in the information of the hemoglobin A now makes it hemoglobin S, and that changes the structure of the red blood cell from that roundish thing to a sickle shape or half moon or crescent moon. Right? So that's where we got the name from, sickle. Sickle is a knife kind of that you use to harvest rice and all of that.
If you're not sure of the sickle or like the crescent you're talking about, it's more like a C kind of a structure, like a C. So yes, the alphabet C. So that's what sickle looks like.
Yes. So that's how it looks like. So the shape distorts, and this makes it sticky. So they tend to stick together. Instead of moving freely, like I mentioned, they tend to stick together, and by sticking together, they block the tubes or the pipelines. You know, let's say a lot of debris have stuck together and passing through a pipeline.
Just like we had floods, the gutters get choked, and then the flood.
So the blood vessels get choked. So if the blood vessel that's going to the hand gets choked by these sickle cells, then blood does not get to the end organs and the result is pain, a lot of pain in the bones, and then in other areas, in the stomach, in the joints and all of that. That's why when they come to hospital, we try to flush their system with a lot of water to separate the cells from sticking together so that they can carry oxygen to the organs.
Okay. Well, that's that in-depth definition or explanation of the term or the disease. Now, straight away, we've already even started mentioning some. Let's look at the symptoms. What will somebody see that will tell that this person perhaps may be suffering from sickle cell?
Well, the symptoms, like I said, I already mentioned some. So we have what we call vaso-occlusive. Vaso-occlusive means it's occluding the blood vessels. All right, so we have vaso-occlusive crisis. And this is when the cells stick together and then they block the blood vessels. And so there is not enough oxygen to the tissues. So they complain of severe pain. That's one of the commonest symptoms. Bone pain, joint pain, pain in the abdomen. So that's one of the symptoms. And then, like the name suggests, anemia. They are always having low HB, and so they get breathless easily. They don't. They get easily tired.
When you say low HB, that is
low hemoglobin level.
Okay.
Right. So they easily get tired. All right. They are lethargic. Now, in children, it manifests with what we call hand and foot syndrome. So you see the hand is a bit swollen, and then the foot are also a bit swollen, all from the same explanation, So if you see a little child who is born to a sickle cell parent and you see the hands and then the foot are swollen, you know that it's a manifestation of it. And they may have poor developmental growth, and then also some may be prone to infections, so that's for the kids. Now, we also have what we call aplastic crisis, where the bone marrow is not able to produce enough of the red blood cells. All right, and all the cell lines. We have other cell lines. We have red blood cell, you have platelet, you have white blood cell. The white blood cells fight against infection. So once you have the aplastic crisis, which is usually precipitated by a certain virus, then there will be anemia. One, you can bleed easily, and then also there could also be repetitive infections. Now we have what we also call sequestration crisis. Now this crisis occurs when the spleen is also an organ in the abdomen. It identifies these sickle cells as foreign bodies because the spleen knows that your red blood cell is round. Now all of a sudden it identifies some sickle-shaped cells flowing through your blood. So it identifies them as foreign bodies and it starts swallowing them. So your spleen drinks your blood, as it were.
Wow. So
the spleen, which is usually not palpable or you cannot touch in your on your abdomen, now becomes a big tumor in your abdomen. So many of the sickle cell people, you may see a protruding abdomen. All right?
Like Koshoko?
It looks like that, but it's not really Koshoko. It's the spleen which is enlarged from drinking the abnormal blood, and for such crisis, if it gets very severe, you have to go and remove the spleen so that you will not die of severe anemia. So that's the sequestration. And then we have what we call hyperhemolytic crisis. And that one is a breakdown of the cells, right? The normal red blood cell lasts for about 90 days before it dies, but the sickle cells usually last shorter. And when there is a certain crisis, it may, or in an infection or something that precipitates the breakdown of the cells, you have a lot of the breakdown, and then what it shows is that jaundice, yellowing of the eyes, because there is so much of what we call bilirubin released, and it colors the eye. All right, so you have yellow eyes, yellow skin, so you see most of them with yellow eyes. It's because their red blood cells are breaking down, and so basically that's what we see with sickle cell anemia patients.
Okay, so these are basically some of the things, usually when it has gotten to the extreme level, basically.
Yes.
But at what points, as a parent, should you say, okay, I think I need to see the doctor with my child.
Yes.
Is there some other peculiar stuff?
Yes.
you look
So,
out for?
like I mentioned, if you see the hand and foot syndrome, if you see that the child's hands are getting swollen, or the child is not doing well in school, or the child is complaining of pain all the time, bone pain. Oh, my joints are paining me, especially when the weather gets cold, and they get this kind of pain very often and very repetitive. And if you see that your child is not growing well, right, it's lacking behind his or her peers, right? So if you see all of these, then you should be alerted that probably
You should see a doctor.
Yes, you should see a doctor for it.
Okay. The other thing that I also want to look at, we've already mentioned how it's even get to be. For instance, I mean the causative, basically that.
Yes.
Let's talk a bit about that and perhaps the risk factors.
Yes. Now the causes, like I mentioned, is not something that is caused by either an infection or but it's a mutation. Now let me explain a little bit about the mutation. Several years ago, it's thought that about 70,000 to 100,000 years ago, that's very, very long time ago.
Wow.
That is when this mutation originated. All right, God created us with perfect red blood cells, but along the line, about 70,000 or 100,000, 150,000 years ago,
Wow.
people were walking, and all of a sudden, boom, hemoglobin A has changed to hemoglobin S. And these kind of changes is thought to have occurred 3 times in Africa. And then one is thought to have occurred in Saudi Arabia and then Central India. All right, so about 4 mutations occurred. So the hemoglobin A changed to hemoglobin S. All of a sudden, it changed. We don't know how it came about, but it's a mutation. And the same form of mutation also causes cancers and other things. So hemoglobin A changed to hemoglobin S. Now, there are other forms of changes that also occurred. Another change occurred to hemoglobin C. Another change occurred to hemoglobin D. And there's another called hemoglobin O. Even that one, we add Arabia to it. That's what is thought to have occurred in Arabia. know. So the hemoglobin A, you need 2 of them to form a normal red blood cell. Now, if you are not lucky and you inherit one of the S, which is the first one that changed, and then you inherit another S, then you have a full-blown sickle cell anemia. All right, so we call it homozygous. They are the same SS. And that's when they are the typical ones. Now you can have an S, and then another change that also occurred along the line. We call the C. All right, so you can have hemoglobin S and then a C. That also is a sickle cell anemia, and then they suffer the same crisis. Then we have the SD, and then you have the SO. They are not common, so we don't usually talk about them much. Right, so once you have an S and then another abnormal gene, we call it sickle cell anemia. Now, if you have an A and then you have an S, it's a trait. It's not a sickle cell anemia. They don't suffer the crisis unless maybe the proportion of the S is more than the A. Where they can have a little bit of the symptoms.
But if you have one X, it means you're likely to contribute to perhaps a child who may have an SS.
And that's where prevention comes in. Okay. Prevention is okay.
Yeah, let's look at the risk factors. Yes. I read something, and I was told that in America, for instance, it's basically the black people who mostly get this. Why?
Yes, that's the history I was talking about.
Yes.
The mutation occurred in Africa.
Wow.
So if the mutation had occurred in the Caucasians, maybe America and other places, then it could be more prevalent in those areas. But the mutation several years ago happened to have, maybe one old man was walking to his farm and then he had a mutation, and then he passed on to the daughter, and then and it continued in our line. So of course when the slavery occurred and then they sent them to America, they carried the genes to America, they intermarried, and then some whites are also getting, but they are not so much.
Okay.
Yeah.
I'm also told that there are some complications that these having a red blood cell, sickle cell could lead to. There are some complications. Other diseases. What are some of these complications?
Yes,
that we are looking at?
the complications basically are part of what I mentioned, like the sequestration thing. Your spleen can be so enlarged, and if you don't take care, it can kill you, because your spleen is drinking your blood, and so you lose blood. All right. And then you can also have breakdown of red blood cells. So when those cells break down rapidly, you get severe anemia, number one, you get jaundice, and then your kidneys may shut down because it's now overloaded with the burden of removing a lot of the bilirubin out of your body. All right. So your kidneys may shut down, so they can get renal failure. Now, the blood blockage that occurs as a result of sticking together, it can occur in the brain. And guess what? When your brain blood cells get blocked, what happens? Stroke. So you see a young child having a stroke, that's sickle cell. So these are some of the complications. So
that's what you want to chip in.
I want to ask. So after this whole situation with someone who has a sickle cell, is it true that the person there's no way to salvage the situation? And definitely the person would pass on?
Will live with it. No. Pass on now is not very common. Now, once you have sickle cell, there's no way it can be changed unless something divine. All right? There's no way the genes can be changed. But it can be managed. It can be managed. All right? And these days, they are doing newborn screening. So we screen them early when they are born, and then they put them on treatment, and it's a simple penicillin that they give them, and they can take it for up to 5 years. And so the things that used to kill them was the infections, streptococcus pneumonia. They get pneumonia, meningitis, and all of that, and they die. Now, because of the simple penicillin they're giving them, most of them are surviving, and most of them have survived for years. And most of them are actually very brilliant.
Yeah.
Yes, very, very.
That's one thing I've noticed. People who have some natural deficiency, perhaps from birth, usually make it up with some extra intelligence and all that.
Yes.
Like the autism children and all these stuff. Anyway. And my reading also told me that there's something they call like leg ulcer, and which can be a complication.
Yes. Venous ulcer. So, if you have the blockage of the blood vessels, all right, to the end organs, if you have a little bit of wound, you need a lot of oxygen, nutrients to go there and heal the
white
wound.
Blood cell and all that.
Yes, white blood cells.
Infection.
Yes. Now, because of the sickling,
they
they don't get adequate of these things to get healing quickly. So it's a ulcer that can prolong for a long time, and so that's one of the complications. You're right.
All right. Now let's go on to we've already mentioned the causes, but how can we prevent this now that we know that this is what's happening? We have a rule. I'm sure we do have a rule. God has given us a chance to really prevent it. How do we prevent this?
Well, the prevention is avoid marrying. Two people with sickling traits should not marry, or should, as much as possible, think of the possibilities of the outcome of
by the traits
marriage.
You mean ASAS?
ASAS. All right. Sometimes the love is so strong that they don't hear anything. Oh yes, it happens a lot, But then when you're dealing with a child with sickle cell, and they're waking up in the night, they're running to the hospitals, now they think like, oh, we could have avoided this,
So you need to think about the future.
You need to think about the future,
your kids through.
What you might be putting your kids through, and it's not funny. Sometimes they are so much in pain, you give them the highest forms of painkillers, and most of them are now pethidine addicts. Most of them are pethidine addicts. Pethidine is a very strong opioid that we use in the hospitals, and it's addictive. And most of them come and then, okay, give me pethidine, give me. So before you know it, they are addicted, and then you have to send them for rehabilitation and all of that. It is a very, very time-consuming, energy-consuming, psychologically traumatizing. Everything.
It's very draining.
If you're going to marry and you are so much in love, think of what I'm just saying, and then make wise decisions. All right. So the prevention basically is counseling and then wise decision making. Once they are in the world already, what we can do is to prevent death. And that's one, like I said, newborn screening is helping. We're giving them prophylactic antibiotics. And then as and when you see that they're having crisis, you rush them to the hospital. Don't stay in the house and then, okay, no musuka cry, work hard again. You know, we've seen people die just at the entrance when they got to the hospital. So get them to the hospital as quickly as possible. They will flush their system with fluids because, they, like I said, the cells stick together. So the cells will not break, and then more blood will rush to the end organs. They will get better quickly, and then they'll go back to school, right?
Yeah, I'm a little passionate about this because I've lost 2 friends to sickle cell, so it's kind of unfortunate. But the point is, yes, like you've mentioned, you advise married people to really desist from marrying. If you are AS, get another person who's AS. My question is, how often do you get people coming in like, oh, we are getting married, so we want to check our, cells and see what we have? Does it even happen?
Rarely. It doesn't happen all the time. Now, some churches are making it mandatory. So we see them coming with their counseling forms, and then they say, oh, pastor says you should come and screen.
So it's because the pastor says?
Yes, pastor says you should come and screen. So it's because it's mandatory in the church, so they go ahead and do it. But then we should take it upon ourselves and educate the public as much as possible that, look, screen before you marry. Very, very, very important, because what you will have to deal with if you bring a sickling child into the world, it's much more than, unless, of course, your resolve to, marry is more than.
Yeah, when the love.
Yeah, that's the point. So I'm wondering whether that's when you start being friends, then you go and check and know. Or
yes.
I think one other way that will help easily, that I think we should all know what we have, what our cells is. So as part of knowing what's your name, where are you from, you ask yourself stuff, so you know
right
whether
from the beginning before you get into it.
Before it gets so deep that it can get out.
Yeah.
I think we should be looking at something like that.
And like you said, it's quite a prevalent burden now, because it's thought that about 200,000 children are born annually in Africa with sickle cell anemia, and 80% are in sub-Sahara. So it's a lot, and we are seeing them a lot. If you go to the big hospitals, there is a special clinic for them, sickle cell clinic, which is run by doctors specially trained, to manage sickle cell cases, nurses specially trained to manage sickle cell cases, and they follow them up all the time,
All right, that's basically, in wrapping it up, if there's something else, some sort of advice you'd want to give generally to the general public, of course, this is the time.
Yeah, so basically we've seen what sickle cell is. We've seen that to deal with it, it's time consuming, it's energy consuming, it will consume your finances because you'll be frequenting the hospital a lot of times, all right? Psychologically, it's traumatizing, all right? So it's very important that you prevent it by not sharing genes with another person who has the same trait, all right? So if you are AS, I try as much as possible to marry an AA person or a sickling negative person. And there are so many of them. There are so many of them.
Okay. Why are you laughing? You are one of them.
No,
so you want someone to come and marry you.
You see, that is where the problem is.
Anyway, as I said,
utilizing the
eyes of the beholder.
So maybe you see this person, that's the person you want to go for, but the person has. But obviously, you need to look into the future and see what you be putting your kids into.
I honestly think that's the easier way is just get everyone tested. Everyone should know it off head and know what you are, so you know things from the beginning. Ask the basic questions you ask the new friends you make, and that will be a better way to handle this.
Is it that expensive to check your sickling?
Oh no, it's not. I think maybe if you have 20 cities or so, you can get it, or even less, you can check your.
Then it means we can all
check
do that, so that you know before you get into it.
Exactly. Anyway, so before you leave us, perhaps you'd want to give somebody who's listening to us and still wants more answers. Unfortunately, we don't have enough time to do that. We'd want to come to your outfit or give you a call or something. We'd want to give us a direction and perhaps a number to call.
Okay, so if you want more information, of course, you can talk to any doctor. He will give you a lot of information about it. If you want to see me, you can come to Doctors in Service in Abra, just opposite the mosque, the Abra main mosque, right, just by the roadside.
All right, so that'll be it for now. Thank you very much, Doctor, for talking to us. All right, so that was Dr. Andrew Herzuah of DIS, Doctors in Service Limited, giving us all the education we need to know about sickle cell anemia in that sense. So as you listen to us, we know that we have a role to play, because